Usec, we just talked to Dr. Limpin of the Philippine College of Physicians at nag-aalala nga daw sila dyan sa shift to GCQ with COVID cases rising to a record high today at mukhang balak daw nila mag-appeal sa government. And then we also talked about hospital capacity na although the Department of Health also said you will be reconciling your figures with their figures, diba, with the doctors. Ano ba sa tingin nyo ang sitwasyon talaga sa hospital capacity in the NCR muna? Sige, NCR kasi tayo
NCR, yeah, actually, ang NCR natin, pero let me put it this way po, Mamami. In terms of the lockdown we're looking at, especially with this granular lockdown, and the timing of it, no, especially with the GCQ, I mean, it really catches the issue because we are now on a peak of 22,000 with about 6,000 in Metro Manila, and there is a sudden shift towards a GCQ. But the thing is, the strategy of implementing testing, tracing, and of course isolation, and the vaccination and the treatment, it's still there. It's still the same basic strategy. Nothing really has changed. It's just that we actually adopted a mechanism or a strategy wherein we have to learn to live with the virus. In other words, if we have to put ourselves in a zero COVID strategy, it won't guarantee that there will be no COVID new cases. And we have seen this last year and for this year, wherein we tried to do as much as ECQ, but still, the COVID cases kept on coming. And they are now trying to look at this from the strategic point that if we do something which is really granular and lacking or targeting this kind of lockdowns, pretty sure that we could have a very good balance between moving up our economy and definitely also of putting the necessary public health intervention.
Yusek, pero nga yun nga daw ang problema na wala naman daw corresponding increase in capacity, especially in testing and contact tracing. So dyan mga kalugar na ilalagay yung granular lockdown, i-intensify ba yung capabilities na yan?
Dapat it should be. I mean, the implementation of the granular lockdown is this is going to be the very issue because in implementing and the execution of this, the local government unit has to be very strict and with certain rules because this is the only way that we can keep the transmission low. But in terms of the healthcare capacity, if you ask here in Metro Manila, the Metro Manila area, as we see right now, the HCUR, the total collective HCUR, is in the threshold of a high-risk position. And the ICU is already on the high-risk category, meaning to say that a lot of this COVID-dedicated beds and even the ICU are getting to be filled up. Now, one of the reasons for this is that even if you have a 6,000 new cases per day here in Metro Manila, we were able to handle almost 10,000 during the last waves before in Metro Manila. But this time it's different because in Region 3 and Region 4A, you have high risk or critical risk positions for the allocated beds and the intensive care unit. And there's actually coordinated transfer and referrals down in the NCR. So that makes the NCR a bit more, well, in a way saturated in terms of the number of HCUR. But what we are saying right now is that the number of mild and asymptomatic cases, if we even take a look at the stats for this, it is roughly about 97%. So in other words, if you have more of this and you have about 2% of moderate and about 1.8% of the critical and severe, this is totally different from what we saw the last wave that we had, wherein the critical and severe was at 4%. And I think this is one of the reasons also that the ramping up of the vaccination and probably a better kind of community quarantine that we had in the past few weeks, we were able to come up with a situation wherein there is less severe and critical patients compared with last. So I think there are many factors that can be attributed.